Welcome back to the fourth Public Health International Conference Plenary Session 2. How are you people? Still excited? Now we are heading to the second plenary session.
In this session, we will have Dr. Eka Lestari Mahyuni, SKM MCAS, as our moderator who will guide us to the second session. But first, I will introduce her. Dr. Eka Lestari Mahyuni, SKM MCAS, is graduated from Faculty of Public Health from bachelor, master, and doctoral degree. She has been working at Training Development OSH Center USU, Secretary Epitreat Unit USU, and now working as lecturer, Faculty of Public Health, Occupational Health USU. So, ladies and gentlemen, please welcome our moderator, Dr. Eka Lestari Mahyuni, SKM MCAS. Dr. Eka, you may have the floor.
Okay, thank you, MC, for handing over this event for me to lead. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everybody. Thank you all for joining today's webinar of 4th PICO in second plenary session. I hope all of you is staying healthy, although we're still facing the pandemic of COVID until now, but it doesn't make us have to stop and still have to excited, especially to join in this conference. My name is Eka Lestari Mahyuni, and I am a lecturer at Occupational Safety and Health Department in Faculty of Public Health. And now I will be moderating this session. Of course, it's very pleasure to be your moderator in these important sessions, where we will talk about the role of public health in empowering society in managing COVID-19 pandemic. Today, we will hear together from the speakers that has coming from Taiwan, Thailand, and Netherlands in this virtual Zoom meeting. Before starting, I want to say hello to all the speakers. Hello. And participants, hello, assalamualaikum. Welcome and nice to meet you in this Public Health International Conference. And it's very gladful to meet with you, all of speakers who can attend in this conference to sharing the information that you will present later. Before presenting the material, I want to convey the material that will be presented by the speakers. Basically, this conference is very important and interesting to follow because there are a lot of information and innovation to solve the COVID-19 pandemic that will be delivered by the speakers. But all of that will be easier to understand if the all participants in here are active and discussion will run effectively. Similarly, like first plenary session, we have a few housekeeping notes in this session. First, today's session is being live and to be available for viewing post-conference at YouTube FKM USU ACID. And the second, if you have any question for the speakers, please use the chat feature in this Zoom webinar. Write down your name, company, and your question in smart and to the point statement. Third, each speaker today will have a total of 45 minutes for their presentation and 15 minutes for discussion. And the last, we will send you all the relevant links after the event at chat feature in this Zoom webinar. Great. Let me start this session with say Basmalah, Bismillahirrahmanirrahim, and deliver one of Pantun for all of you here. Go traveling to Mexico to enjoy the vacation. Welcome to the 4th PICO. Hope you'll enjoy this session. Now let's welcome to our first presenter, Professor Cheng Chuan Chan, the Dean from College of Public Health, National Taiwan University. Ni hao ma, Professor?
Yeah.
Yeah.
Thank you for your introductions. And I'm Chang Chuan Chan from National Taiwan University. It's my pleasure to share with you some of my thoughts on what public health can do during this pandemic and probably post the pandemic.
Okay, I will explain your brief personal curriculum. In here, Professor Cheng Chuan Chan is an expert in industrial hygiene and pollution control, where he get it from his education at Harvard School of Public Health. He also has professional interest in particulate matter, environmental epidemiology, exposure and risk assessment, and global health governance. He also has so many grant research activity and publication related of that. And today, he will share information about the Taiwan model of COVID-19 control and its global implication. Great. Now we respectfully welcome to Professor Cheng Chuan Chan to present the material. Please, Professor, the time is yours now.
Yes.
Yes, please.
Yeah. Okay, I'll try to share my slides first. Then, okay. Can you see?
Yes, we have seen it.
Okay. All right. Today I'm going to talk about the Taiwan models of COVID-19 control from a public health perspective. I'm now teaching at the National Taiwan University, and I'm also academic chair of a newly established Asian Pacific's hub of so-called Reforms for Resilience, which has been established in London, UK, and in the coming years, you probably will hear more about this. I think that's a kind of commission we established during this pandemic, and we would like to welcome more the Asia Pacific participants to be involved. You know, in this ongoing pandemic, Taiwan stands out as good examples of containing major outbreaks until now. So countries around the world are looking to Taiwan to seek the reasons why we can do it. And I will give you this success story back in 2020 that until May, you know, we make tremendous success in containing the outbreak. I can summarize in this slide. The story of this is we have a very good central command that time. I call it 4 tiers joint command centers, starting from the president and the executive end. That is our central government. And under our central government, we are Ministry of Health and Welfare, which in charge of the health issues. But the real work on infectious disease is done by Taiwan CDC, Communicable Disease Control. So the 4 layers of government work together, and they can make timely situation evaluation, decision makings, and command the executions. So it's ran very smoothly to contain our outbreak. So let's go back to the timeline from December 2019 to May 2020. This is one of the chart that I can show you. So on top of that is World Health Organization's actions, you know, for the first months, as you can see from WHO's advice, you know, always advice against doing things. That's the first month of WHO advice. But in Taiwan, we have done 4 things from the beginning. One is border control The other one is digital tracing. The third one is social distancing. And the last one is, masking is social. So the four things we have implemented back December 31st, 2019. And you can see that Taiwan is one of the country act very early in the beginning of the pandemic. And we made decisive decisions to start quarantines that flights from Wuhan and later Spain traveling from Wuhan. Because we learned from 2003, the SARS outbreak. Anything happen in China in terms of infectious diseases outbreak, even though you cannot confirm 100%, you got to be very cautious. That's why we the first place in the world to start doing this border control towards the Wuhan that time. So the success of Taiwan stories on containing this COVID-19 is we act earlier, so you can see over the 3 weeks in January 2020, we have already set up a central epidemic command centers, and based on the information we have, we upgraded week by week. And from the beginning, we don't have any medicines, only vaccines. We can only rely on non-pharmaceutical intervention measures, which are digital tracing, social distancing, and masking. So think about it. We start restricts exports of masks back in January 24th, because that masks that time were the best available controls devices we have. So we start doing this in order to have a universal masking policy we have, So this part need a lot of citizens' participation and community involvement. So I would say our citizens, our people are so much engaged in all activities of infectious control from the beginning. So move to the second month. We have more bans on a lot of travel from not just Wuhan, later the whole China, because we just don't know what situation of the pandemic occurring there. Later on, we know that the majority of cases are actually concentrated in Hubei province, and especially Wuhan cities. And but remember that WHO still advise against travel or trade restrictions. And we took a step further to ban cruise ships, right, back in February 6th. And because we have been visited by a cruise called Diamond Princess, and that cruise ships has made a lot of problem in our regions. Several countries has been affected by this. So we have to do this quick. And fortunately, we contain this and no outbreaks by interchange between our local people and visitors. And for social distancing, we made us also a wise decision to postpone our spring semesters that allow us to have more time to reduce public gatherings, mass gathering, and reduce the context and reduce the risk of transmissions of then still largely unknown virus that we encounter. And one thing I have to mention is we enforce a name-based mask distribution systems. You know, during the pandemic, these kind of things can help citizens to be actively engaged in doing things that good to contain pandemic. And a very simple way of getting mask, that's a channel to mobilize the citizens to do things that's good for themselves and for the society. So we practice this name-based mask distribution system, you know, island-wise and weekly, and you can be allowed to purchase 14 masks for each persons. So people are engaged in this universal masking practice in starting from February. And, you know, later on we ramp up our productions and, you know, and also we build these mobile phones, electronic fans back in March. So one features of Taiwan's ways of containing the pandemic is technology. So you have to use the technology and try to compete the speed of the transmission of virus. And digital technology is one thing we can do. Okay. The other one is the so-called social distancing, and I'm working for. I was a dean of the School of Public Health then, and we have weekly briefings, and we first proposed the term social distancing to our society and request for at least 1.5 meters distance and better 2 meters distance, try to reduce the close contact of people. So this also very important during the pandemic, and with academic credentials, we actually can empower our citizens with knowledge and to change their health behavior and to do good things for the societies. Okay. And later on, we encounters a very important a cultural event that we have this Taoism religious event that attract probably 1 million people for a period of 2 weeks. So we use social persuasions with the leaders of the religious groups and ask them to change the schedules and reduce the crowd and change the way they traditional do for this we call Maju parade, and that was also successful. Okay. Wait. So this is a reason if you look at our first half of 2021, for a very long time, almost 9 months, Taiwan ranked as per million people's confirmed case. We are very low, and from this graph, you can see Indonesia was also quite good compared to the United States. That our case numbers were low from that time, and until now, we encounters after the 2021, we start having some outbreaks. But for the year of 2020, I think many countries in Asia, including Indonesia, are doing quite well. But after May of 2020 until December, when Taiwan models was quite successful, and there's some good things and bad things I have to brief you. The good things is we have long periods without community transmissions, so the daily life of the majority of people in Taiwan are quite normal, and the reason we can keep it that way is we enforce very strict border controls, which stay until now. That means a lot of business travel, studying exchange, academic, and conferences, all this has been stopped by this strict border control. That means we don't have a lot of possibility of imported case to our society. It's good. And public cooperation is very high, for the whole years. And our masks from the rationing to surplus, so that Taiwan was engaged in health diplomacy. We have to send out our masks to over 100 countries who are in need by the mass production we have in Taiwan. I think we have contributed to many countries in controlling the COVID during the time we don't have vaccines. Okay. Well, there's always the two sides of a good policy. The other one is bad sides. Because of long periods without community, the society become presences. So we did not have enough awareness to try to plan something in advance. So, for example, we make our society has become lack of urgency to vaccinate. Okay. So that's one of the difficulty we are facing now is we did not plan early enough to buy enough vaccines for use this years. Okay. We did not plan well the strategy out of the pandemic. After so long border control, how can we be reconnected to the world, right? So these are the bad things that the later part of 2020. We saw the first major outbreak during this pandemic, starting from May this year's, and as you can see, that is right after Indonesia has a big outbreak late February this year, and we start seeing this outbreak. And what makes it happen? When the world pandemic reached like 64 million cases, and the whole world has this variants of COVID-19, including Alpha, Beta, Gamma, Delta, back in December 2020, right? There's so many happening. That means the pandemic has changed its characteristics. We are no longer during the pandemic of Wuhan. We are during the pandemic of different variants, and so the way Taiwan's models can succeed back in 2020 cannot guarantee we can have this success again. And that means the non-pharmaceutical interventions we had before could and could not be sufficient for us to handle this. So when the worst confirmed case were beyond 100 million cases in February, we have first hospital clusters and community spread back in January 12th until February 9th. Because of this, we tighten hospital visit regulations and we enforce contact tracing, all these things. And it is really very harsh that people who are sick and are treated in hospital cannot have relative visiting him or hers, So that's very, very painful to our society. But in general, our citizens still follow this strict advice. So because of this instance, plant the seed. Starting from May, we have this big outbreak we never seen before. And for daily cases, we can increase from a single digit up to like 100s, then over 500s in a very short terms. So from May until now, we are in a major outbreak that has not ended. At the time I am speaking to you in these lectures. So what happened exactly? The reason for that is we have very limited vaccination rate. The share of people who receive at least one dose on May 22nd is very small, insignificant numbers. And I told you, the May we got this outbreak. So low vaccination rate among our population is one of the reasons we have this difficulty of the major outbreak in Taiwan. The other one is the virus is different from Wuhan strain. So currently, the major outbreak in Taiwan is Alpha variant. So Alpha variant has more transmissible. It's more transmissible than the Wuhan strain, and so that's why we have this outbreak. So let me go through with you. It's back in May 14, 15, at that time, and we start seeing the cases from 16 in 3 days, reach 160. And by the end of May, we saw that almost 600 cases, and the deaths can be like a double digit that time. So that's a serious problem. So facing this, our government imposed the Level 3 pandemic alerts in May 15. Again, we act very early when we only have a double digit cases. We enforce the Level 3 epidemic alert. That means soft lockdown. Workers are encouraged to work from home, and the mobility of the people in the city reduced significantly by not going to work, not going to study, and stay home orders. So there's very fast reactions, quick reactions to this pandemic also prove a swift reactions to pandemic is very important, that we can cut down the transmission. The other one is we increase the testings. By increased testings, you can find the cases earlier and quarantine them and cut down the transmission's chance. Another big difference from the success back in 2020 It's during this pandemic, it is a local government who play major roles of cut down the transmission chains. Taiwan's governmental public health infrastructures has major three layers. On the top, we have Ministry of Health and Welfare. It's under the executive end of the central government. And currently, we have 22 public health bureaus. For cities like New Taipei City have like 4.5 million population, to small counties has less than like 300,000 populations, but all of them have public health bureaus. And under the public health bureaus, we have public health centers, you know. So public health centers are directly under the public health bureaus, so they are under the jurisdictions of local governments, but with professional supervisions by central government. That means our local government, 22 local governments, have direct power to dispatch all the public health manpower to fight for COVID. So that's why they can take very quick actions this time everywhere in Taiwan. For example, Changhua County Public Health Bureau, you know, this county has a population over 1.2 million in an areas over 1,000 kilometers squares. And the Public Health Bureaus has 10 divisions. They are doing medical administrations, pharmacology and substance abuse prevention, food hygiene, health promotion, disease control, laboratories, planning, information, long-term care, public health inspection, and admissions, right? So they are doing a lot of things, including disease control, that's infectious disease controls. And under that bureau, Changhua has 27 health centers. And leadership is important. Dr. Ye Yanbo, as a long-term director there, he has a medical degree and PhD in public health from our colleges. Sorry, and he specialized in infectious disease control. So during his leadership, he initiated a comprehensive screening program in the county for cancer, for non-communicable disease and infectious diseases, etc. You know. So basically, he built a very good community-based public health program, which can be ready to fight for any emerging diseases. So these programs and activities not only help develop connections and trust with the local community, but also enhance the knowledge and skills of public health workers. Both are necessary to ensure an effective public health system that can competently deliver essential public health service in time of need. Okay, so Dr. A's achievement helped him to stay as director throughout change in ruling political party in this county. You know, the county governors are democratic elected every 4 years, and his professional teams has never been changed by the change of this governors. So that's one very important one. So for example, for Taiwan Changhua models, they use a precise screening, active surveillance. You know, that means for every identified case, Changhua will quarantine the context of the confirmed case, as well as context of context. So we have 2 layers of protections that we can make sure our control measures work. So until now, there's 0 cases for almost over 20 days already, even though we see 271 cases there. The 5-day PCR positive rate now is zeros, and number of people screening is over 14,000 already. And as you can see, that for every confirmed case, we contact tracings over 3,000, people. That's a big efforts for public health workers in this local government to do. And what I'm trying to tell you is the local public health manpowers and professional skills very important. And Changhua County of Taiwan can show you an examples, and cooperation between local governments and academic has also been important. We have long-term cooperation with this county over 20 years. So we have several graduates working in local public health bureaus, centers. So they become a very competent workforce in the time of pandemic. That's one of the reasons that we can contain the outbreak this time so successful. So the rest of 21 local governments are not exactly the same, but they are doing a lot of things that Changhua County is doing, because Changhua model it has been copied in different counties, and they are doing quite well too. So the challenges of May 2021 is our testing numbers are not high enough. Vaccinations, the availability is a problem, and the willingness for some age group, especially the elderly ones, are still need to be encouraged. Not really the vaccine hesitancy, but we need to have more health literacy education to increase willingness for people to get vaccinated. The clusters we saw in this major break is from tea parlors, as kind of socially and culturally difficult part for our public health to do preventions. And there's stigma there too, because the society saw that places during the pandemic as so-called bad place to be. So the people from there could be stigmatized by the infectious disease that we have to overcome for this challenge. And the high population density is always a problem for infectious diseases, and hard to keep the hygiene to the standards we need. So that's the challenge. The other one is migrant workers, also was involved in this outbreak. And so the increased restrictions for letting migrant workers, more migrant workers to come in Taiwan has become more restricted. And inside Taiwan, the movement of these migrant workers also has been reduced. So this is a challenge we have to get out of this pandemic earlier, then we can go back to the more normal. So some action has been taken, the PCR test has been increased, and rapid test, home rapid test especially, has been allowed, and people are purchasing this to do their own personal care. So the theme of this conference, we are talking about empowerment. So if we have tools that let people to be voluntarily to be involved in pandemic control is better. So ART is one, things, but because of this data issues coming around in all the countries in Asia now, including Taiwan. So we have to increase border control again, increase the restriction again. So this is will make it more difficult for us to open up. Okay. So for example, the vaccination uptake until September 14, 2021, if you look at the Taiwan compared to Indonesia, we have higher one dose, but lower fully vaccinated. That means 2 doses. Okay, so this is kind of challenges. If you look at New Zealand and United States, that's at the least we have to reach 50% or 60% fully vaccinated. That was the goal. That is a goal we have to meet. But if you look at Delta now, probably we have to go as high as 90%. So it's a long way for us to go, including Taiwan and Indonesia. How can we get enough vaccines to do vaccinations in timing way will be a big challenge for us. The factors driving the low vaccination rate is public's perception of risk-benefits analysis, especially when you have low infection rate, and those people will think there's no need for vaccine in a hurry, okay? And also some side effects that we experienced when we first used AstraZeneca around February time, that when people learn about that, and there's a lot of interpretations by social media and not by the professional, not by public health academia, then it's become a bad impressions for some vaccines, right? So that's very important. Anytime when there's adverse events of vaccines, our academia has to go out very early and to interpret it in a scientific way that the audience, the general public can get the right information. Okay, and geopolitical issue is also one. Asia as a whole, it cannot get secure, sufficient vaccines we need, except some countries, right? That's so we do need, and we also don't have sufficient manufacturing plants in our region to even to supply vaccines we need for many countries in these regions. And a lot of countries like Taiwan, we act too late to secure vaccines. So now the market is so tight, and we are even more difficult to get enough vaccines we need. And I would say this many countries also have shared this no urgencies syndromes of getting vaccines. That's including government and the citizens, so that's the challenge we are facing now, and we have to overcome it as soon as possible. And domestic vaccines, if we can get some, good. And Taiwan, we do have one brand, but there's trust issues because of this development path is not followed through yet. So, but we need to use this soon. So this speedy authorization has damaged the trust of the people in Taiwan on the domestic producing vaccines. Another one is testing. Look at this. Before this outbreak, the yellow lines, the yellows were the red lines I point to. We increase significant from a very low testing rate to now is about 1 per thousand. That's needed. But if you look at Indonesia's, it's still not up to 1/1000 testing. It's not enough. But if you look at other countries like United States, there's many times reach 5/1000. But if you look at most tested country like United Kingdoms and Singapore's, we need go even higher. So testing is very important to move us back to normal for this COVID pandemic. So I think we have to increase testing, including Taiwan and Indonesia. And how to do that? We have to enforce like community-based, hospital-based testing. That's what we have done in the last 4-6 months, and we also have to implement rapid testings for people who with or without symptoms. Whenever they want to attend a mass gathering, important events, or indoors, I think this very important. So the shift in responsibility and actions from central government to global government, from the government to people, I think that's the testing policies way up ahead we have to do. The other thing that we are facing now is foreign workers in Taiwan. If you look at this migrant worker in Taiwan, end of 2019 and July 2021, in these two figures, Indonesia is a country that helped Taiwan a lot by graciously export the manpower to Taiwan to help us in two main sectors, social welfare sectors and production industries, and especially the social welfare centers that's taking care of a lot of our sick people and elderly. So that's very important to us. And but you can see after the pandemic, the numbers decrease, okay, because of the border control. So that's create a kind of anxiety and almost crisis in Taiwan, because our social welfare and production relied to some extent on the migrant workers' contribution to our economy and our society. So when there's some outbreak and there's some news talking about that migrant worker could be a source of outbreak in Taiwan, and we act very early, and we find the facts, and we kind of stop the scapegoats for some people, or especially some politicians in Taiwan, to say that migrant worker is not scapegoat for spread of COVID. That's very important. So there's a cultural things, ethical difference, always make us public health people very aware. We have to be culturally sensitive in doing our public health works, and this is just example, and especially during the pandemic, and it's happening in many countries. I just show you Taiwan is no exceptions, but we did very well to contain until now. That's as a matter of fact, this is foreign workers in Taiwan, the infection rate is not higher than our domestic one. So that's the scientific facts that can give people right information and help our public health actions. Okay. So what we have fared so far in terms of daily new confirmed case, adjust for populations, Taiwan is quite low, as you can see from this curve. We are on the bottoms. And Indonesia's used in September's beginning of September is very high, and fortunately now is coming down quite rapidly. It's a good news. But we see the Philippines is increasing. So pandemic, if you look at this curve I show you, is still around, especially in United States, still rising. But in our regions, some are rising, some are declining. But bottom line is we are still in the COVID-19 pandemic, and there are still months, even years to go to get out of this pandemic. The deaths, we have high deaths before, then we have cut down, and there's and I saw that Philippines and Indonesia are still experiencing some of high deaths that left over from the infected peoples in the past few months. But we are seeing a consistent decline. It's good news. But one thing is very puzzle is so-called case fatality rate. That means number of deaths among the number of infected peoples. And in this outbreak, Taiwan has very high case fatality rate. That's beyond 5%. Worldwide is about 2 to 3%, like and Indonesia like close to 4% is also very high. But if you look at United States, Netherlands, you know, there's case fatality days is lower than 2% and even lower than 1%. So that's related to our public health response and also medical care capability combined together. So this is one challenge we have to face together to find out how can we reduce these case fatalities for both Taiwan and Indonesians. So lesson learned, you know, border control and act very quick as we learn the information, and we can do it well. And the Taiwan models show you that once you have the information, and even you cannot confirm, you have to ramp up your public health measures, and you have to be ready to contain the infections as early as possible. And how to do that? The 2003 SARS outbreak in Taiwan make Taiwan spend 17 years to build that infrastructure for infectious disease control in our community, in our academics, and in our hospitals, and it pays off. It looks like this way. So this is very important ways and of containing newly emergent diseases or new outbreak. That's we are still learning during this pandemic, but some lessons has been very useful. Yeah.
Your time is has up. Maybe
okay, so I'll finish this. Okay, so for the coming months, I will stress importance of testing, you know, and importance of implement science-based vaccination strategy, and shift from central efforts to local efforts. That's the end of my talk. I hope my talk on the Taiwan model can give you some good information that you can use and to be referenced to your local actions. Thank you for your attention.
Okay, thank you for the best presentation from Professor Chang. It's to be a good lesson to know, yeah, more the model of Taiwan that has presented by the professor in this discussion topic maybe. And of course, the COVID is still concern, and we have to very serious to secure about this pandemic. Yeah. Okay, maybe from the participant, if you have a question to the professor, you can raise your hand or write down at the chat future. Yeah. Yes. We have a question for you from Maria Siregar. And her question, she is a student from postgraduate University of Sumatra Utara. Taiwan response to the coronavirus pandemic is one of Maria, yeah. Sorry. Maybe we change, yeah. The first question is from Mr. Chuang, from Tengku, from University of Sumatra Utara. She is given a question: how to defend your community with new variants of virus with this limitation of vaccine supply? Yeah, and do you believe that the new variants can make recent vaccine effectivity not powerful anymore? And the last thing, how Taiwan going out in this outbreak situation become an endemic, or perhaps your society are ready for living a life with this disease together? Maybe that is the first question, and we will continue with Maria. Sorry, Maria, you have waiting for this.
Okay, just quick response. Yes, we cannot defend without a fully vaccinated population. So that right now, the whole society is trying to get sufficient vaccines from all possible places and to vaccinate our population as soon as possible. So at least we will reach 60%. That's the government said, but academia like to go over like 70% by the end of years. So this is the only way. And the variants we believe will become more contagious in the coming months if there's new ones coming. So we public health has always to take a precautionary principle. That's to plan ahead of the time. I think that's the way. But we still very comfortable with people work together jointly. We can defend ourselves against our common enemy, that's the virus, right? So we public health professional has to give people the hope that we can always try our best to defend every one of them, and that's but with the knowledge we have, with all the tool we have, that's I think kind of things I would like to share with you. Yeah. Okay. How about the next questions?
Okay. Thank you. Maybe Tengku Mossadegh can receive the answer, yeah. And we continue with the second question from Maria Siregar. He needs to know information about how is Taiwan paying attention to the mental health of patients who have recovered from COVID-19, and what is the role of health worker in that to handle that? Because we know that the mental health is an important issue that must be considered. Maybe this about the mental health, sir, please.
Yeah, from the beginning, we saw that even from the isolations, peoples who are quarantined for 14 years, and also those who are infected, and we have to have supporting systems to do that. So there's a hotlines of supporting phone call that everyone can reach out to this, both government run and also NGOs running this, to have a mental health support. And more important than that is our health professionals, right? They are under such a stressful working environments for over 1 year now, over time, all of this. And so the hospitals has some of supporting system for them, but I would say it's not enough. That's it has the pandemic has dragged so long. So this kind of fatigue for our health workers and all the public health professionals in this has gone through very difficult. And I agree, this is the main part of public health we are facing now. On top of that, a lot of parents, during this pandemic, there's work from home and children are put in the home. All these mental health issues would be arising, and not to mention for those confirmed cases. There's a long COVID, so people who has been infected COVID could possibly never recover to the full functions of their health. So those kind of things that we have to worry about that. But for now, the first priority is still to contain the pandemic first. But don't forget that our public health is looking as health as a whole, and mental health is usually the one part has been overlooked, and we have to advocate. We have to look at these health problems, not easily to be seen, but very important. Very good questions. Yes.
Okay, thank you, Professor. So the important thing is about the health, yeah? Don't forget about your health. Okay, next question for you, Professor, from Natasha Siahaan. He needs to know about how big is the role of health promotion media in overcoming the COVID-19 pandemic in Taiwan, and how is the government handled with the hoax news related to the spread of COVID-19? Maybe you can answer this directly, sir.
So at the beginning, that Taiwan CDC and together with Executive M, and I was one of person as expert invited by them, and decided to make health education for the community through the televisions. So every 30 minutes in Taiwan, you will see health communication message, broadcast by doctors, nurses, opinion leaders in Taiwan. So no matter what program you are watching, what channels, you always get this most updated informations. Yes. The other one is this most difficult misinformations of COVID. So government has a branch, searching all these misinformations every real time, and they will give this misinformation to experts. So for me, I got consultation a couple of times and try to verify whether such information is correct. And I will give them some professional advice. Once this information has been verified false, and the government will send out from the social medias and to counteract. And also in the next day, some of the newspapers will publish this in yesterday, such and such false information about COVID. So this is the two ways we are doing this. But frankly speaking, it's very difficult. That's misinformation. Since once it's out, and it has already affected a lot of people. So this is actually an area our public health schools has to start spending more research on this. How can we come back with this misinformation of health informations in a real time, in an effective way? And I can only offer you some of Taiwanese way of dealing this, but frankly, it's not as success as I like to see. Yeah. Okay. Any other questions?
Okay. Of course. Thank you, Professor. But we have still question, but the time is up. Yeah. So I'm so sorry for Olivia and that had raised their hands, and the next question about the digital tracing. But because the time, maybe we can hold it and change to and continue to the second presenter or the second speaker. But very grateful about the question, and thank you for Professor Chang Chuan Chang. Maybe we can continue this session, yeah. And now we continue.
Okay,
to
thank
this,
you very much. Yeah.
Yes, you're welcome, Professor. And now we continue to the second presenter, the pretty young lady from Naresuan University, Faculty of Public Health, Thailand. Welcome to Associate Professor Supaporn Sunongbua, PhD. Sawadee ma'am.
สวัสดีค่ะ
Okay, I'm so sorry if we are late to starting for you. And
okay.
we can see, okay, thank you. We can see her curriculum vitae in the screen. She is a lecturer at Faculty of Public Health, Naresuan University, Thailand, and passed her Doctor of Philosophy in Health Science since 2011. She is expert in elderly health, community health, qualitative research with thematic analysis and mixed method. Also expert in quality of life and minorities health. She has current research article in 22 articles and have 3 textbooks as publication. Wait. She also a reviewer and editorial board of international journal that indexing by PubMed, Medline, and Scopus. Wow, this is a wonderful information, and maybe for students and lecturers, we can collaborate in academic improvement in research or others. Then today, she will talk about the role of policy in preventing transmission of COVID-19. So to shorten the time, let's welcome Ms. Supaporn to present in this conference. The Zoom platform now is yours, please.
สวัสดีค่ะ
Selamat siang.
Selamat siang.
Selamat siang.
Today, I'm going to discuss or talk or share the experience of Thailand in terms of COVID-19 outbreak. Okay, we are going to go to the first slide of the role of policy in preventing transmission of COVID-19. For this, as everyone knows about coronavirus disease, the characteristic of coronavirus, the protein cover all around coronavirus is like this. Everyone knew. First, in the morning, I listened to the news about coronavirus. Now, somebody may know about Nipah. Do you know Nipah? Nipah virus is the variant virus that happened recently. Nipah virus are from bat. A bat. The bat bite fruits and blood from pig. The people who eat pig, who eat the fruit that is bitten by bats, can cause Nipah. Nipah is the name of the newest virus in the world at the moment. And some researchers believe that Nipah can cause COVID-19. Nipah virus is the variant virus that can cause, may cause COVID-19. Some researchers believe that. At the moment, they found that Nipah virus is very dangerous virus in the world. It's happened in Malaysia in 19 something, and then Singapore, and then Malaysia, Singapore, and India. Eventually, at the moment, it's happened in India. And Nipah is the name of the city in Malaysia. The first time of Nipah virus happened in Malaysia. So everyone should know that bat is a cause of any virus. can cause any viruses. As I has experience of research about a bat. At that time, I was the researcher of USA. Then we discover about the cause of the disease that can contact a bat, that can cause from the bat at that time. So from now on, we should be aware of the source of virus. In terms of situations of COVID-19 pandemic, as many countries have been threatened by coronavirus in 2019, so we call COVID-19, and the government policy in every country has been launched in preventing transmission of COVID-19. Then, two major ways to prevent the COVID-19. The first way is to prevent the cause of the disease. And the second way is to prevent the transmission. So, two major ways. Then we will go to as the major way, the two major ways I told can set up to be the policy to protect and to treat the people who get the COVID. So I would like to tell you guys about the COVID-19 situations in Thailand. So I will go to the link. Can everyone see the link? Okay, here it is. This is a Thailand situation of COVID-19. It's reported on 17 September, today, today at 2:00 p.m. So total 1 million, around 1 million people had got COVID-19. See, then new cases around 14,000 and serious 3,000, and this one is the total, yeah, and 15 people are dead. See, at this report, for the report today. So and then we report about the traveler screening at the port of entry as well. So as you can see that the COVID-19 is very we can contact COVID-19 easily. As the WHO reported, the COVID-19 can be airborne disease at the moment. So we will go back to my slide. So the role the Thai government tried to set up the roles of the policy, try to set up the policy in preventing transmission of COVID-19. The major role for preventing COVID-19 is the role of Ministry of Health. According to the Ministry of Health task, they distribute the task for healthcare workers. And the second one is health volunteers. And the other one is other volunteers happen in Thailand. It's happened because of healthcare provider shortage. That's why other volunteer happens. The people who are willing to help others that from dying from COVID-19 or people who are sick from COVID-19, the other volunteers help them. For the health, they help to transfer the patients from home to hospital, and they transfer the people who die from COVID-19 from home to the temple. They help to transfer the Thai health medicine to the people who get COVID-19 at home. Transfer Thai health medicine to treat them at home. These tasks are the tasks of other volunteers. See, in the crisis, healthcare provider shortage, we have not enough healthcare provider at the moment. So that is the reason why other volunteers happen to help healthcare provider. So this means that the government should consider about the production of healthcare provider in the country, because at the moment we have not enough healthcare providers compared to the patients who get COVID-19. So the impact on vulnerable people. Come back to the impact of vulnerable people. As I told you, healthcare provider shortage. So we have not enough healthcare provider because the COVID-19 spread in all people, including vulnerable people. The impact of such pandemic has been exacerbated in all people, including vulnerable people, such as homeless people, minority peoples, elderly people, and children, even children, including the migrant from our neighbors, such as Myanmar, migrant from Myanmar, migrant from Cambodia, migrant from Laos. So the government try to solve that problem because the exacerbate is very serious. The policy in Thailand. The policy in Thailand is divided into two strategies. First strategy is proactive strategy, and the second is passive strategy. In terms of proactive strategy, surveillance has been employed among people who are at risk, of infection, in order to seek people who get infected COVID-19 and separate them from others. The rapid test has been used by people themselves as a result of healthcare provider shortage in this crisis. The risk people are provided antigen test kit, so we call ATK, by the government for free. Yeah. And work from home or online study happened. Lockdown zone in some area, especially in the dangerous area or dangerous province in Thailand. The government divide or separate or the province in Thailand is they divide in category: the red zone, yellow zone, and pink zone and white zone. So if the lockdown zone in the red zone, because the red zone is there are a lot of infected people in the red zone, so we lock down the red zone. And state quarantine for the people who move from the red zone to other zone, they need to do the state quarantine. And the government set up the Phuket Sandbox. Phuket province is the special place in Thailand because a lot of foreigners wants to travel in Phuket. Many people know well about Phuket. It's the popular place, right? And the sand is very clear and the bridge is very nice and beautiful. So the government knew about the place. We want to prevent COVID-19 and we need income as well. So that is the reason why we set up Phuket Sandbox to be the model from other provinces. So just try the Phuket Sandbox to be the pilot project. The people who want to, the people who live in Phuket need to be vaccinated at least 2 doses. So every people in Phuket need to be vaccinated for 2 doses of vaccine. And the people who want to go to Phuket need to be vaccinated at least 2 doses of vaccine as well. So it's like sandbox. You can imagine that. The box, put the sand in, just limitation this area. And the Thai government allow foreigner to come to Thailand, but they need to do the state quarantine in Phuket only. It means that they need to confine themselves in Phuket only. It seems that they can travel and can do the state quarantine at the same time in Phuket. But before coming to Thailand, they need to be vaccinated. I mean the foreigners. Yeah, so we call Phuket Sandbox. And at the moment, Phuket Sandbox is the model. And now the government set up Pattaya to be the Pattaya Sandbox as well. Pattaya and can be Chiang Mai, can be just the travel zone in Thailand will be like the Phuket Sandbox. Okay. That is my slide. Moment. Now, and also the government set up the policy in Thailand that all people in Thailand need to follow. We call DMHTT. DMHTT means D, distancing, M, mask wearing, H, hand washing, T, testing COVID-19, and another T is Thai China mobile application for surveillance. So every Thai every Thai person need to download Thai Chana application. Even me, I need to download. I have Thai Chana application as well, because every people need to be vaccinated. They need to download Thai Chana in order to register Thai Chana and Mo Chana. We need to register our name and ID card and ID number in Mo Chana or Thai Chana, in order to identify that I got vaccine, in order to identify that, okay, where I am or where I am. So they can, they will know and they will follow where I am in somewhere, in order to know that the people who got or the people who got COVID-19, they want to know or find out the people who got COVID-19 live in. We will know where they are, something like that. So this kind of the MHTT policy is, I think it's work in Thailand, because we are encouraged to download this application from the Thai government, because after downloading, we can get a lot of welfare. We can get some welfare as well, especially the vaccine. For the MHTT policy is like this. So now we will go to vaccination situation in Thailand at the moment. I just get this data from the news in the morning, and then I add in my news slide in order to tell you guys about the situation that is very updated. Yeah, I just got this information in the morning. From overall 100 million doses, is the target of vaccination in Thailand. Now we have 48% of Thais were vaccinated. 48% of Thais were vaccinated, and 52% of Thais are going to be vaccinated. Of those 48%, Thais were vaccinated, 35.35% got 1 dose of vaccine, and 11.75% got 2 doses, and 0.89% got 3 doses of vaccine COVID-19. The people who got 3 doses are healthcare provider, yeah, at the moment. And then in the 1st of October, Thai people who are 12 to 18 years old will be vaccinated. The people who have been vaccinated 2 doses are allowed to travel across provinces in the country. Yeah. For me, I just got one dose of vaccine. Next month, I will get a 2nd dose of vaccine. Thai Health study for alternative COVID-19 treatment happened. Actually, the people, I mean Thai people, we use Thai herb, this kind of Thai herb, we use this for a long time, but we don't know that it can improve the patient conditions and relieve symptoms without major side effect from COVID-19. We don't know, but our ancestors used this kind of herb for a long time. And now some people try to use this kind of herb when they got COVID-19 and then they feel better. Yeah. Then the government encouraged Thai people to take the Thai government by the FDA of Thailand allow people to use this because the side effect is just a little bit. The condition, the indication to use this kind of herb, we will take this kind of medicine when we get COVID-19 only, not for protection, but for treatment only. And FDA of Thailand allow Thai people to take it when they get COVID-19. So we call Pha Thalai Chon, and in the chemical name is Andrographis paniculata. It's really hard to pronounce. It's chemical, but it's hard to say in biology name. I think biology name, yeah. But Thai people know Pha Thalai Chon is easy word. Pha Thalai Chon, and we plant a lot of Pha Thalai Chon. We can see it around Thailand. In every places in Thailand, you can plant it. But we don't know. In the past, we never know. And now we know. In the past, we never knew. But now we knew. Then a lot of people, a lot of houses, people in the house and people in many areas plant this in every family. Almost every family in Thailand try to plant it. If they get sick, in the past, our ancestor, when they got high fever, just eat the leaf of this kind of a Pha Thalai Chon and chew it, and then swallow. After that 1 or 2 hours, the fever has disappeared. Yeah, and the pharmacologist tried to research about this kind of herb, and the researcher found that it can treat the fever. It can treat some virus, and then the people who got COVID-19, they took it around 2 capsules per day. They feel better and better. Yeah, that is the reason why the government encourage people to use it, and FDA allow Thai people to have it, to use it. Yeah, so now it's popular in Thailand. Yeah. But in the past, nobody knew that it can treat COVID-19. Nobody knew. Just it's like herb. It's like general herb. Everybody ignore. But now everybody is interested in this kind of herb. Yeah. Also, the orange peel extract can be the vaccine in the near future. It's discovered by the researcher at Chulalongkorn University. Chulalongkorn University is the top university in Thailand. Because this university is the government university, and they got a lot of funding for doing some research. And rutin, they found that rutin is the thing that they extract from orange peel can kill the COVID-19 virus. At the moment, it's in the research process. Yeah, in the trial. Yeah. So tobacco leaf extract can be the vaccine for COVID-19 as well. Yeah. Now it is in the trial process. Yeah, by the researcher at Chulalongkorn University as well. So you can find out more detail in this link. So I will send the link in the chat channel in here, and you can search and read some detail. Yeah, so we call this kind of tobacco leaf, Thai people call tobacco leaf as Baya. Baya means tobacco leaf. Yeah, we extract for the vaccine. Yeah. The thing I told you is proactive strategy. So now we are coming to passive strategy. For the passive strategy, temporary hospitals or field hospitals have been established for providing primary care to infected people who have been severe. Because at that moment, in the crisis, the hospital, the beds in the hospital is not enough for infected people. So they screen the people. The people who are very severe will be transferred to the hospital. But the people who are the moderate severe or low severe or just moderate, they don't need a lot of equipment. They don't need a lot of oxygen or something. Can be transferred to the temporary hospital and field hospital. So it's set up. We set up temporary hospital in this at school as the creation center, at school or creation center at university. We use some space for setting up the temporary hospital and setting up the temporary beds, yeah, and the place for transferring the people who get infection. Some Thai herbs have been used for primary care as the government allowed to use them for COVID-19 treatment. And risk people are tested. The screening of COVID-19 by healthcare provider. COVID-19 vaccination has been provided to all people. The government provides financial support for producing COVID-19 vaccine. And mRNA vaccine is made in Thailand. It's coming soon. The latest developments of Chula, we call Chula COVID-19 vaccine. Yeah, we produce mRNA vaccine. It's gonna be the newest vaccine that made in Thailand. Yeah. It's different from Baya vaccine, and it's different from the orange pill vaccine. It's different. This one is just, we invited the professor from America to cooperate for producing mRNA vaccine. Yeah. With respect to limitations of the policy, fatigue happens among healthcare providers. Shortage of healthcare workers occurs during the pandemic crisis. Although the government tries to launch the policy about production healthcare workers, it may not serve in the crisis in time. Mutation of the virus leads to a decrease of vaccine effectiveness. And awareness and concern among people are keys to alleviate the outbreak. Outcomes of the policy. An increase of volunteers emerged during the pandemic crisis. Collaboration happens in society. All sectors, community leaders, health volunteers, infected people and their families have cooperated for preventing the transmissions. Internet network has been improved as people need to use for communication, online shopping, online study, online working, online meeting, online selling, and etc. The newest COVID-19 vaccine has been produced. According to the outcome of the policy for the pandemic, outcome of the policy are divided into two categories. The first, short-term prevention, and the second is long-term prevention. For the outcome for the short-term prevention, the COVID-19 outbreak has been decreased. The infected people will not spread the contagious virus to others. Few hospitals or temporary hospitals are used for the infected people to stay for primary health care, and for contaminating to others who are not infected. Imported COVID-19 vaccines are used for frontline healthcare workers and people who are at risk. For long-term prevention, COVID-19 vaccine has been produced and will be used in our country entirely.
Sorry, ma'am, your time is 2 minutes more.
Okay, thank you.
Yeah.
Thank you for reminding me. The newest vaccine will be produced to mitigate the variant virus or coronavirus mutates. Medical technology will be improved continuously. People have learned from the COVID-19 crisis, and they will know how to protect themselves in the long run. The production of healthcare worker will be increased. And the motivation for healthcare workers will be concerned for sustainable tasks. COVID-19 vaccine has been injected in all people entirely. Healthcare provider will be enough if the outbreak happens. Troops of healthcare providers will be prepared for the outbreak. Medical equipment will be enough and ready to use at all times. And target of the policy. Collaboration is a way to drive the policy for reaching successfulness. Highlighted prevention. The actual role to prevent the COVID-19 is the role of everybody. Individual concern is a key to prevent the pandemic. See, we should cooperate between policy, people, healthcare provider together, and then we will eradicate the COVID-19 together. Okay, for my topics is finished now. Any questions?
Okay, thank you for the interesting presentation. Yeah, with the proactive policy, we have found the Thai Channel Mobile. There is a good application, and there is so many strategy that the presenter, the speaker said. how to managing the COVID-19 in Thailand. Also, Thailand has the Chula COVID-19, the mRNA vaccine to protect their community. Overall, the actual role to prevent COVID-19 is the concern about the individual concern. Yeah, that is an important thing, I think.
Yeah.
Okay, let's check the question for you, Mrs. Supaporn, in the chat box. We have found that a question about from Rasna Sultan. Maybe this is about how the government managed to control people health-seeking behavior. I think you can answer this related, but there is we have a question from Mem Kalsum Samsudin. This is from Malaysia, I think. Yeah, and he asking about you. Could you share with us how to regarding the measures implemented by the Thailand government to ensure public compliance to the DMHTT policy there? That is the interesting strategy, I think, in here. Maybe you can answer that, please.
Yeah. For DMHTT, DMHTTP, we can measure by looking at the decrease of COVID-19 or the number of people who get infected. Yeah, who get infection. So we can see from the people who get infection from COVID-19, we see the number of people who get. And every day the government try to announce about the number of dead people, the number of the people who get infected, and the number who get better after treatment. Yeah, so we can follow the number of the patients or the people who get infection. Yeah, can be the measurement.
Okay, thank you. And the next question, yeah, we have the raised hand from Tengku Musaddek. Maybe you can directly asking to the speaker, please.
Could you please turn on the microphone?
Yeah, you still unmute, Tengku. Sorry.
Oh, I'm sorry. Thank you very much for Ms. Eka and Ms. Supapon. Thank you for having me. I just want to asking about the topic, and it's about your country, especially about how the country in Thailand make the health worker problems, especially like a fatigue and maybe any limitation about health worker can be solved. How the contribution from the academician happen in Thailand. Thank you.
You mean how the government solve the problem about healthcare worker shortage, right? You mean how the government do for the healthcare provider shortage? At the moment, the government try to provide the scholarship for the students who are interested in. No.
Sorry, I am concerned about. I mean, how to, the country supply the health worker.
Supply.
Supply
Yeah,
the health worker.
Provide the health worker. Yeah.
Yeah, providing the health worker into facing the pandemic.
Yeah, we got problem. Yeah, we got problem with this supply because it's not enough, and then that's why we the government established temporary hospital in every area in Thailand, in the province, in the district, in the sub-district. We set up the temporary hospital in the sub-district and encourage healthcare health volunteer to help healthcare worker. We are at the moment in the we have health volunteer in every sub-district in Thailand. They can help the staff. They can help the staff in the temporary hospital that we establish in every sub-district in Thailand. Yeah, we solve this kind of shortage. Yeah. Healthcare provider. Yeah, in the community will do it, and the community leader encourage other people in the community to help together, and the volunteer happen. You know, it's happened. They are not trained about health, but they learn how to help the staff. They learn how to help the staff, just short training and then do it. Yeah, it's happened in every area in Thailand in last 3 or 2 months. Yeah. At the moment, Thailand is better than before. We have crisis. Yeah, around 4 months before. Yeah, last 4 months, last 6 months, we had crisis, but now we are better.
Okay, thank you for the answer. Yeah, and we have the next raised hand in here. Okay, welcome back, Olivia. Maybe you can asking your question in this part. Yeah, Sheila, please.
Okay, thank you for the change, Miss Eka, and thank you for the explanation, Ma'am Supapan. I just want to ask a simple question, actually. If you look at your explanation about how Thailand solved the problem about COVID-19, well, it has a similarity in Indonesia, such as the HDT. I mean, we did the same thing. I mean, like, what is that? Yeah.
And
using distancing, mask wearing, and yeah.
And it's the law in Thailand. It's become the law. If you do not use the mask, you will be fined, and it's illegal. Yeah, it's law. Yeah.
Well,
if you don't wear mask in public place, it's illegal. You will be fined. You need to. Yeah, it's become the law in Thailand.
Yes, I just wondering. The regulation in Thailand, is that really strong? Because we have a similarity resolution to resolve the problem, but from my opinion, the regulation is not really strong. Like the punishment is not been effective. That's it. That's what I want to ask. What makes the regulation in Thailand was so strong? The effective too.
But when first time when the government announced, people ignore. Okay, some people ignore. The police go to that people and ask them to give the fine and punish them, give them the punishment, and after that other people, we should follow the law. Yeah, but first time when they announced, nobody interested in, just ignore, just the law, just and after that we are afraid of that because some people get the punishment from the government. Then we need to wear the mask when we go to the public place. Even you are in the car, for 2 people in the car needs to wear mask, because the police will be in some spot. We will wait for you along the way. You need to wear mask. Over 2 people, need to wear mask in the car. But if you are alone in the car, you don't need to wear mask. But over 2 people and over need to wear mask. Otherwise, you will be fined by the policeman. It's illegal.
Okay, thank you, Mrs. Supapon. Yeah, maybe it is same, but not same, yeah, Olivia.
Yeah.
And Thailand has a nice and a great program with the MHTT. Yeah, although maybe we can take in same in application of Thai China Mobile. Yeah, maybe in here we got a Peduli Lindungi. Yeah, that is our application in Indonesia. And I think it is answered by the question from the chat box from Ma'am from Ma'am Maria, yeah, it is same like Peduli Lindungi. And the next raise hand, there is you are interesting speaker today, yeah, from Eka Prahadian. Please, Eka, you can asking directly.
Could you please turn on the microphone?
Yeah,
Okay, thank you very much, Mrs. Eka. So we are the same name now.
Yeah.
Yeah, the same name.
Eka, same name.
But different sex.
Okay, so thank you for the chance. I would like to know about the, as I know that the Thailand is one of the best country in the region, if I'm not wrong, who work with the drugs related problem, because many rehabilitation centers is based on the Thailand today. So is there any policy related to the COVID controlling among the drug user or among the drug rehabilitation center that developed by the government? Because as we know that a lot of the drug users living inside or outside the recovery centers, but at the time there is also what we call it relations between the counselor, the drug users, during the counseling, during the sessions. Of course, it will give impact to the COVID-19 infections. Is there any policy that Thailand have today to control specifically the COVID-19 among the drug user or the drugs rehabilitation centers? That's all. Thank you.
Oh,
Okay.
thank you for sharing.
Yeah. Okay, please.
Can
Maybe we
I
can-
ask?
okay.
Can I ask you? I just want to know. Do you have a healthcare worker shortage in Indonesia? Is that the same problem? Eka.
Yeah, Eka, you Supapon's asking you. It is same in Indonesia?
Oh,
Maybe you still unmute.
okay.
Okay,
Yeah.
sorry. Yeah. Can you repeat again the Ms. Supapon, the questions? Sorry.
Healthcare provider shortage happens in Indonesia.
The healthcare who work
Yeah,
with the...
healthcare worker. Yeah, shortage happens in Indonesia.
Yes, we have.
Oh, so how do you solve that problem?
So we have sometimes, it's very often we have like a working group who working at the same the field or the same area, and then we try to capture that the problem among the worker, and then what kind of issue that we have in different place. It's like, you know, that we have a very huge number of provincial or the district and then the city level. Because different province, we also have the different problem, and then the culture, the traditions. Of course, we first of all, through the working group, we will capture and then raise the similar issue so that we can develop something that can address and then can use in the different type of the province or area. So that's in the very basic level. Of course, we will have the working group and discussion about the common issue.
I think in Asian country, we are ASEAN. We are ASEAN, so we can help to each other. It's like the crisis in India. When the crisis in India happened, Thailand, the Thai government sent the oxygen tanks to help the Indian people in India. Yeah, and after that we got crisis. and after that we need oxygen. But the oxygen tank in Thailand is enough. But after donation, we got the crisis. And I think if Indonesia need help from Thailand, you can ask for the government. I think the Thai government can help other country in ASEAN as well.
Okay.
We will help each other.
Okay, thank you, Ma'am Supaporn. I think it's enough because the time is over now. And thank you very much for your presentation today. And we will continue to the next speaker.
Yeah. Okay, thank you.
Okay, you're welcome. Okay, participants and all here, the audience in here, this is the last but not least presentation, and we still have a time to hear and share information with the beautiful and charismatic woman from Netherlands, Professor Dr. Hebel Katarzyna M. Zabanowska. Goedemiddag. Welcome to Indonesia, ma'am.
Thank you very much.
Yeah,
Thank you for this
welcome.
invitation. I'm extremely honored and proud to be at this conference.
Okay,
And yes, especially that I have a PhD student from Indonesia, Hervanswa, who probably is in the audience and who is writing the PhD thesis about maternal care. So I'm double proud to be with you
we
today.
are proud too. We are proud to invite you here. It's very honorable can meet and sharing information with you in this conference. Okay, maybe we can start. Yeah, let me see your curriculum vitae in the screen. Professor Zabanowska is a professor of public health leadership and public health workforce development at the International Health Department, Maastricht University, the Netherlands. She is also the honorary member of the UK Faculty of Public Health and direct governance and leadership in European Public Health Program. She has published around 200 scientific articles in peer-reviewed journal, and she is the past president of the Association of the School of Public Health in the European region, an academic board member of the Studio Europe at Maastricht University. She served as a World Health Organization expert in the area of public health leadership, public health workforce development, and planning and public health system. And today, she will share with us about how to bridging gaps in public health competency-based education lesson from the COVID-19 pandemic. This topic is very important to us. We can learn to solve the problem in community related with COVID-19, of course. So all participants, don't miss out of this information, and let's listen in carefully. And don't wait again. Welcome to Professor Zabanowska. With all due respect, please, the time is yours now.
Thank you very much. And I will share the screen. Yes. So if I may start, when I was thinking what to share with colleagues during this conference, I was thinking about bridging gaps. We are in a specific situation now, and the COVID pandemic, and I've listened to several presentations now and how you work and struggle with the pandemic, but actually it is related to bridging gaps. And it's warm in your country, and maybe the picture that I show is a little bit different, but you probably think that we are at a certain moment in time, and we are trying to move to a better future. And we are moving on our own, or we are bringing our colleagues together with us, our students, our communities, and our society, but it's not easy. So you have probably observed that we are also working differently, and we are leading differently, and we are learning differently. I would also like to address the critical competency gaps that we have encountered now due to COVID pandemic, and how this reflects on leadership education and training And the motive of this conference is how to empower the communities and how to have impact on the communities. So what does the leadership education mean for us? So first, working differently means leading differently. We all have experienced a sudden and radical change due to COVID. We have all experienced social and physical isolation, and also the immediate shift to distance and online. A lot of colleagues had to work remotely in restricted workspaces for a long period of time, and there was a sudden push to digitalization. Look at the conference that we are having now. And this required new leadership qualities, especially empathy for another human being and flexibility. But it also required from us open and transparent communication. And you know how important it is to communicate when people are waiting what to do next, and also to communicate with our colleagues and how students, and how to make sure that in spite of being online in remote areas, they still stay motivated and want to perform and deliver. But we found ourselves in a very complex situation. And I like to show this figure, which is a causal loop diagram demonstrating the complexity of the COVID pandemic, the system thinking. While we touch upon one thing, and you know how COVID strikes, then it is all interconnected. Interconnectedness is one of the qualities of the pandemic. So when we look at health, we look at the health of the health workers, of our populations, at social interactions, at vulnerable populations, at interventions, and what government can do, at air pollution, panic and fear, and at economic markets, at international trade. It is all connected. And one of the qualities of healthcare professionals, public health professionals, is to being able to deal with complexity and interconnectedness. And here I would like to share with you the WHO ASPER. ASPER is the Association of the Schools of Public Health in the European region, the competency framework that was developed to help public health professionals identify the skills that they need in different areas. And this competency framework was developed together with WHO, and it is based on the systematic review of all competency frameworks worldwide, including those in Canada, in the US, in Europe, and in Australia. And these competences were undergoing systematic reviews by experts. What we come up with is the division of competences into 3 areas: content and context, and these are related to specific public health epidemiology, statistics, and public health regulations and law and One Health, and relations and interactions, and performance and achievement. And if you look more in depth, you see the areas which are covered in the competencies. So here in content and context, you see health promotion, law, policy, and ethics, and One Health and health security. And here the problems of pandemic and the competencies you need are included there. But also collaborations, partnerships, communication, advocacy, and then the performance. Because in order to be a public health professional, you need to know what is the organizational literacy and how to perform in a professional, ethical way. So we also look at these competencies from the position of 3 levels. And once you enter the field of public health, you are at the level of competent, but then you want to progress, yes, to the, let's say, middle management, and then it can be at the expert level. So what we did, we looked at the competences, and here I just gave you an example of collaboration and partnership, and how the competencies are described. Yes, for instance, here, works across sectors at local, national, and international level in the organizations. But going further, we show how this competency is described for a level 1 professional, level 2 professional, and level 3 professional. So I encourage you, because in the presentation I give the link to the competency framework, to look at it, whether some of these competencies correspond to public health in your culture, organizational culture, and maybe to do some assessment, yes, for the people who work in public health, which competences are needed, especially now in the times of the pandemic. So what we have done with colleagues, we looked at the competency framework, which I presented, through the lens of COVID pandemic, and tried to find out what matters most for public health workforce, for preparedness, in the view in case of global emergency. So what we found, that there are critical competency areas that we need to look at. And it is flexibility, motivation, and communication, and research, strong research analytical skills, but combined with ethics, empathy, and sensitivity to diversity. It's really interesting to find out through COVID that we need a blend of competencies, a blend of scientific, epidemiological, strong skills, and empathy. And that's why a lot of women did very well concerning fighting with COVID. If you look at the Prime Minister of New Zealand, for instance, she's a good example where she combined very well these competencies. So competencies that relate to preparedness and response, and strong leadership and adaptability skills, especially for preparedness in the context of global disease outbreaks, and coping with uncertainty and unplanned events. We need transformative leadership. So when you remember the first slide, bridging the gaps, transforming, moving people from the situation where they are now, helping them move to a different situation. Like from, face-to-face reality, we moved to digital. But it requires communication. So what kind of communication? Emergency risk communication, to be able to provide up-to-the-minute information, which is based on scientific evidence. And it is so important. And I was at the meeting with Public Health France, and the colleagues were saying that it was really so important to communicate, but very often, and you are confronted with it, that we as public health professionals, at a certain time, we don't have enough evidence, yes, but we have to communicate. And we have to be honest and transparent and say that based on the current evidence and research information, we make decisions, yes, but sometimes we have to admit that then the decision could have been made in a different way. But the society, the community is waiting, and we need to trust the evidence that we have from research. So we need to be able to acknowledge uncertainty, be honest, open and transparent, and of course, demonstrate concern for emotional distress in the situation, be empathic, caring, committed, because the colleagues, communities suffer, yes, and they need to understand that public health professionals are there for them and together. So I mentioned leadership, and I would like, I think that you in your programs also devote some time to develop competencies of leadership, which is the skill that nowadays we need, but not top-down, the control type of leadership, but horizontal leadership, transformational leadership that really looks at the society, at the community, and tries to empower the people to cope with uncertainty and complexity. And here is an example of the leadership training at Maastricht University, where we try to teach the students or professionals how to bring change. We use the transformational leadership or change leadership model. I'm not sure if you are familiar with the Kotter model of change. And we develop groups of professionals or students. We like interprofessional groups that people can exchange. And each group works with a different health challenge. So some groups may work with anti-vaxxers and what to do, how to communicate. Others can talk in their group about the limitations and regulations related to COVID and what government should do. And then they try to go through stages, identify the problem, then what is the evidence, and what should be done? How can we best introduce change? And then at the end, once they are ready with proposing changes, they write policy briefs or they present and show how the change can be implemented. So this is really very helpful because they put hands on practice, and at the same time, we coach them and support with mentoring. So maybe those more experienced colleagues or professional coaches support the colleagues who are in the course so that they are stronger and they can face the challenge and they can introduce change in a better way. So leadership is not just something that we are talking about. Leadership can be developed, trained, and supported. I have said a lot about communication, and I like this slide. In order to influence the community, yes, and this is a motto of your conference, we need to rethink science. We need to bring it closer to the community. We need to speak a different language, the language that the society will understand. So a lot of attention and the competency should be towards knowledge translation. Yes, so bring it closer, interact with the society, use the language that the society can understand, practice it. Sometimes we are closed in bubbles or silos that are related to our specific discipline, but there is different time now. So again, we need to bridge the language of the policy, the jargon, to bring it closer to the society. And here is a very nice picture that is from the National Institute of Public Health in the Netherlands, and they really did good job. When they were trying to introduce the changes and regulations due to COVID, they really appealed they did that through social sciences and psychological sciences. They appealed to the behavior of the citizens, and they really worked with behavioral and scientists, sociologists and psychologists, trying to convince people to behave in a specific way. There were teams that were working how to communicate and how to make people behave in a specific way. But they have a very nice leadership academy in the National Institute of Public Health. And they always say that we need to bridge. We need to bridge our knowledge with the society through building different networks. We need to do it through the action-oriented learning. We need to bring new talent. We need to innovate and collaborate with people and connect with the society. So really bridging is something that we need to do as public health professionals. And now for the post-COVID era, we need a public health professional who is able to transform and to bring others to that other, better future. And I would like to describe this person, one of us, one of you. It is someone, and I'm sure that you recognize yourself in this description. It is someone who builds and strategizes the knowledge base and infrastructure for effective public health interventions. Someone who is able to activate system-wide and cross-sectoral networks of relations and interactions that enable the implementation of comprehensive response. And someone who delivers high-quality achievements in public health. Someone who is interprofessional, interdisciplinary, resilient, and digital. And with this, I would like to thank you very much for the attention. And once again, I'm very honored and proud to be part of this conference. I would love to see you all, but unfortunately, it's not possible. Thank you very much.
Yeah, thank you very much. Also, it's very educated, yeah, to hear your presentation in here. And thank you for your brilliant presentation. And we can continue this session with the discussion. Maybe if you have the question for Professor Zabaswa, okay.
You can call me Kasia.
Kasia, okay, nice, Kasia. Okay, we can see at the just the opinion, yeah, the great presentation from Mr. Muhammad Ikhwan. It is a great presentation. Yeah, that is for you. And it's very proud to receive and hear your presentation because it is about how to educate and bridging the gaps. I think the participant can asking something for the Professor Kasia because it is
one question from Herwansa.
Herwansa? Oh yeah. Hello Herwansa. You have raised your hand. Okay, come Herwansa.
Thank you, Ibu Eka, because I think while we are waiting for another participants who perhaps they're still preparing the question for Kasia, let me kick off. So thank you, Kasia, first of all, for supporting our conference. I really appreciate and such a great presentation, as always. You are doing great thing. So Kasia, one question perhaps regarding the leadership in public health experts, because for instance, in Indonesia, take one example, during COVID-19, lots of programs already implemented, but it's hard, I mean, to fully implement it and apply in the society. One of the problems perhaps is trust from the community for the government, because sometimes, from my opinion, my personal opinion, sometimes the policy change suddenly. So without considering the evidence base or the situations in the community. So perhaps you can share your thoughts, what the institutions, in this case, university, can contribute to raise the trust from the community in response to this pandemic.
You know, thank you very much for your very relevant question. And you know that in leadership, trust is one of the most important values. Leaders try to build trust, and it takes a lot of time and effort, but it's very easy to lose trust and then build it again. And rightly said that we often lose trust with governments, who sometimes in a chaotic way try to introduce new policies and then they change and the society is not happy, and that happens everywhere, not only in your country, right? But what is important to build and support community leaders. And as academic institutions, yes, you should have some kind of outreach or possibility to include community leaders who may have good impact on the society. And I don't know if this will be some kind of professional training that is offered or through research, where these community leaders can participate and they can get empowered that their work is meaningful. And through this type of activity, they can have impact on the societies and communities, and slowly build trust from the university through community leaders to the community. It might be a way in your culture.
Yeah, absolutely agree. Yeah. One thing that the most important issue that's in this conference, perhaps lots of people working in academia and also in the government. So it's such a great opportunity to, to combine or to make a deal between an academic and then the policymakers in order to generate a good policy in response to these situations, perhaps.
Mm-hmm.
Yeah.
Thank you.
Yeah.
Thank you
Kasia.
very much. Thank you, Hermancha. He is my PhD student that I have mentioned at the beginning. So please congratulate, because the 2 scientific articles are now under the review.
Okay, congratulations, Herwansa.
And there is a question in the chat.
Yes,
thank you. Any examples
yes.
of knowledge translation concept applied in the Netherlands communities? Okay, thank you. I would say, concerning knowledge translation, there are, you are colleagues from the academia, and there are very good knowledge translation frameworks. If you look at the publications of the European Observatory on Health Systems, that is the organization, and you can look on the webpage, Google this name, and knowledge translation frameworks. And there you have good information on how to do best knowledge translation. There are also specific competencies for knowledge translation, yes, that are related to evidence-based collection of data and communication skills, and how to communicate to different levels of public, yes. And I can also send an article, or I don't know, there is an article that another PhD has written about the competency framework for knowledge translation. And it is also related with leadership skills. The article was published in a public health journal of the UK Faculty of Public Health. So I would suggest to look for the frameworks and get acquainted with the skills you need to have in order to translate best, depending on the audience, depending on the stakeholders, and depending on the type of information and material that you want to translate. But there is now no knowledge development without translating it to a wider public.
Okay, thank you, Kasia. And now you have a question from our Dean, Professor Ida Justina, and she need know about what if the exciting leadership no longer giving trust to the community. And what do you think about that?
Can you repeat if?
Okay, the question is, what if the exciting leadership no longer giving trust to the community?
Okay, the exciting leadership no longer gives trust to the community.
Yes. So what do you think about that? Okay, thank you.
Yeah, thank you very much. So as I hear this question, on one hand, yes, leaders try to be motivating, yes, and show excitement to the community, but the community thinks, or maybe is disappointed and loses trust because the mistakes were made before. Yes. So what I can add, that the most important for leaders are two things. One is consistent value power, showing your strong values that you consistently show in different situations, that you don't change. Then community trust. And another one is expert power. Expert power is how the community recognizes you by the knowledge you have. And then a combination of these two, consistent value power and expert power, are the strongest to build trust. If you are able to wrap it up nicely, if you have the way to communicate, yes, and motivate, then that's very nice. But you see, these two are needed in order to keep trust, because people will quickly recognize that someone is charismatic and can. Charisma doesn't mean much if it is not supported by knowledge, by expert knowledge and strong value system.
Okay, yes, we can note it, value and the expert. Yeah, thank you for the answer, Kasia, Professor. And maybe from another participant, we still have a time to giving the question, or maybe you have full with the completed explanation from Professor Kasia today. Okay, no question more? Yes, the answer from our Dean. Thank you for the answer, Professor. You can
was it helpful, this answer? I have a question to the Dean, if that answered your question.
Okay. Yes. Okay. I think no more question for this session.
Thank you.
Yes, thank you very much, Prof. Kasia. Maybe we can finally Alhamdulillah, we finally come to the end part of the session. And before I giving back to the MC, we would like to say thanks again to all of the speakers. Thank you very much for the informative and interesting talk in your presentation today. And also thank you very much to all participants for the active participation. Hopefully the presentation will be beneficial for anyone in here. And let me closing this session. Thank you very much with one pantun to complete this plenary session. If you want to take a vacation, don't forget to invite your friends. Thank you so much for your attention. See you again in the next conference. Assalamualaikum warahmatullahi wabarakatuh.